Welcome back to the Arizona Daily Mix. This is Health Matters, and we're talking about the governor lifting, of course, the essential surgeries. Am I right, Doctor?
Restriction on elective surgeries.
Elective surgery. I'm sorry. Elective surgeries.
Yep.
Thank you, Doctor.
Yeah.
And let's remind you that you're from
Barnett Delaney Perkins Eye Center.
Yeah. This is so important right now that he is doing this. Am I right?
Critical time to share with the public three key points that I want to get out. One, I commend and applaud the governor for his leadership in providing a safe environment for our community, our patients, and our providers. And he created a safe environment while letting the doctors make medical decisions, which is an incredibly difficult balance to manage, but it's a tremendous step forward for us helping to care for patients. Second point, we're enthusiastic to provide medical services, medical surgeries, medically necessary surgery such as cataract surgery for all of our patients, and that's a critical surgery, not necessarily something that's elective alone, but essential, medically necessary. And then three, it's our understanding that truly elective surgeries such as laser, vision correction, or cosmetic surgeries are back on the table, provided the facilities that we work in meet the standards set out in the governor's orders. And I'm confident that our facilities will meet or exceed the governor's standards because we've been ahead of the curve since the crisis started.
Right, and you and I are sitting social distancing here.
Yep.
And again, you guys are continuing that in the office under those guidelines. And I do have to say that I like how you said thank you to the governor, because he did listen to you at first going, hey, you know what? Healthcares need to be taken care of here, so let's stop some things so you guys can actually get it together to make sure your patients are okay. And now he said, okay, now I've listened to you about letting these kind of surgeries take place to make sure we're taking care of our community, right?
Exactly. See, some of the medical surgeries got lumped into, shutting down salons, shutting down all kinds of businesses. But the reality is, it achieved a goal, which is to kind of protect the hospitals against the surge, and it preserved the PPE. But now that we're seeing a little bit more clearly what the needs will be, he has, as the first step of kind of dialing back in the energy, he has dialed back in doctors doing the procedures they need to do. And it separates the medical needs from kind of all other societal needs, because this is your health, and in our case, this is your sight. And nothing is more precious besides life than your sight.
Right. And you said, as before we came on, about that you're still seeing people about getting their eyes checked, and you want to do that because you guys have the clean facility.
So our facilities have never shut down, the majority of them, and that has mandated that we become COVID compliant, COVID ready. These are words that many businesses have yet to even contemplate, like how do I run a business and keep people safe? Because we have had to run them since the first day of this crisis, we have kind of methodically thought about checking temperatures at the doors. All employees wear a face covering or a mask. All patients will have a face covering or a mask. All waiting rooms, we've taken out half the chairs, so there's social distancing. One of the patients' anxieties that I see is they're worried about sitting in a waiting room waiting for the doctor, which I can't blame them. We've taken out half the chairs, so instead of sitting in a crowded waiting room, it's actually a much more calm and spacious environment, so there's no two patients on top of each other. We respect the 6-foot distance. We terminally clean all of the clinics and the surgery centers every day. So when you bring a loved one or yourself to our offices, you can come without an anxiety of, am I going to be at risk for contracting the virus? Nothing is perfect, but we are doing everything we can, spending hundreds of team hours creating a safe and healthy environment for your patients and for the community.
I love it. I love it. I got to say, I love it because that's so important, because I do need to get my eyes taken care of. And
we're ready for you.
Good. So we're going to go talk about that.
All right. Got it.
Thank you, Doc.
You're welcome.